So now we move on with our next presenter, Dr. Richa. Dr. Richa is the Organic Secretary and Professor Head and at the Department of Forensic Medicine, Sarojini Naidu Medical College, Agra. So, Dr. Richa, can you go?
Yeah, I'm over here. So please, you can share the slides from your side.
Yes.
Am I audible?
Yes, you are audible. Is it visible?
No, presently it's not visible.
Maybe it will.
Yeah, it's visible.
Okay. Please go ahead.
1 second. So very warm welcome to all. Very warm welcome to all the delegates present in the online session. To start with the online, my PPT, actually I've proposed the topic to present an overview over the Child Abuse and the POCSO Act 2012, which is prevalent in and implemented in India all over India. Next slide, please. When we consider the term abuse and we want to see the present scenario which is prevalent in the present scenario which is in the India, we will see that almost 140 per 1,000, 14% of child are of age group 3 to 18, which are abused in one or of the other form in a way like kicked, bitten, punched, hit with objects, beaten up or threatened with a knife or a gun in 1 year. 85% are younger than 5 years and 45% are infants. That means they are under 1 year of age. So seeing the huge percentage of the children which are facing the abuse, this topic holds a high priority in the present scenario. About 10% of injuries in emergencies were due to abuse among under 5 years. 15% admitted patients were due to burn abuse, and 50% of fractures were seen under age 1 year due to abuse. Death rate were recorded as around about 6% due to the child abuse cases. And when you see the abusers, you will see that 55% were seen to be immediate family members which were perpetrators. Father, mother, boyfriend, 9%, boyfriend of mother, 9%. Babysitter were involved to the percentage of 8%, stepfather 5%, and no blood relation has been left which has been used, which were seen in the form of abusers in this age group. Right? When we see the types of the abuse, we will say that it can be of physical abuse, it can be emotional, psychological abuse, it can be neglect of any type, and sexual abuse in the last. When we consider the physical abuse things, we consider all types. And now when we see that what abuse and neglect, is it gender bias? Is it religion bias? No. The abusers belong of all community, all religion, any case of education, occupation, or socio-economic status. But yes, they are more seen among the poor because there is an increased number of crisis situation in life. So they are more prone towards these abnormal behaviors. They are low poor socioeconomic resources for support in stress system. and they hold it as a stress relaxer or a stress reliever to just throw over their tantrums over the younger age group. Increased violence in neighborhood, the background of the society in which they are raised up, this it severely affects the mindset of a person. Teenage and single parenthood and substance abuse is very common. Those seen in abusers, they are very commonly seen have abused to some or other substance. Well, substance abuse, we say that there are 90% abusing parents have neither psychotic nor criminal responsibility. The previous slide, please. It's on auto run mode. Yeah. Stop you. More than 90% of abusing parents have neither psychotic or criminal responsibility, but they were lonely, unhappy. There was a personality defect. It may be young, it may be a single parent, it may be an unplanned pregnancy. They didn't like the pregnancy, they didn't like the appearance of the child, they didn't like some toilet training, they didn't like that child was not adopting the way they wanted to train the children. And that promoted them to their abusive nature, right? 10 to 40% abusing parents were themselves abused as children. So this genetic lineage we will call, or we will say a criminal psychology will passes on from generation to generation. When somebody faces some awkward conditions, awkward situations, or abuse, that leaves a long-lasting impact over that person. It leads either to the depression when that child grows up, either it goes into a depressive form or it will go into a criminology psychology type. So when we think of raising or improving our society, we should think about changing the child perspective, taking it to childhood. How was the childhood? When we see any criminal minded and we trace the childhood, you will see somewhere in the childhood he had an impression, either he saw it behind in the background, he saw it in the abusing parent, or he himself had faced that abuse and it was just a reaction of the childhood which came in the adulthood. Now, a form of physical neglect is very common is nutritional neglect. This may be in sometimes gender bias. In India, basically in our country, the male part has been promoted and girls or females have been facing a nutritional neglect. It not only this, it can be a son, stepson, which may be facing a nutritional neglect. Second type of neglect is a medical neglect. Some, due to some or other reasons, parents promotes one child to provide a medical facility and other person has been neglected, as that is a stepchild or a lagging behind relationship. Now, failure to provide schooling, adequate clothing, protection for environmental hazards like heat and cold. There was a case in which a child was left over outside the home for a punishment for not drinking milk in the night for the whole night, and it was a cold winter, and that child suffered fatal cold stroke due to the winter and the cold weather. So, like this treatment, the abuse is not only considered should be considered only the sexual abuse, but it can be also a neglect in the form of physical variation. Neglect is roughly 50% of the total cases and accounts for more deaths than the physical abuse. Now, what are the emotional abuse? Emotional abuse includes the intentional verbal or behavioral acts which results in some or about some adverse emotional consequences. Means it affects the emotions of the you are not abusing the physically, but by saying something, by saying abusive words, by verbally, by taunting, by literally daily taunting, you are shifting the person and the child is bearing an emotional abuse daily. That would ultimately rejection. It can be a rejection. It can be a scapegoat assignment. A child is targeted and a personal or all the jobs of household chores are given personal to that child. That is also a type of emotional abuse. Isolation, isolating the child in a specific room. Okay, you will be kept over here for the overnight for this punishment. Daily that punishment is given. That isolation is also a type of emotional abuse, and it will affect the emotional growing of that child. Emotional neglect. One is an emotional abuse, one is an emotional neglect. One child is favored, loved, cared, pampered, and the other is neglected. That neglection is also a type of abuse. And it is most commonly seen when it is a stepfather or a stepmother case. Right? A typical disorder was seen as a Munchausen disease by proxy. Medications and toxins may be given intentionally to poison the child, but in this specific syndrome, the parents have the motivation, or they are motivated to, or they are forced, or they are physically they are emotionally bonded to attract medical attention from hospitals, either for just for attention seeking behavior, or it may be for the monetary terms, and for seeking the attention they keep their children neglected or abused or diseased in some or the other way. In very few cases, and in the poor socioeconomic cases, status, this type of syndrome is seen, specifically in the beggars, right, children. They are specifically injured and had damaged or fractured legs or uh, amputated for the purpose of increasing the monetary terms. So in that case, this is the types of abuse which we see in poor status persons. Battered baby child syndrome, it is a physical injury which is totally unexplainable, implausible, and existence of bruise, scars, fractures at different stage of healing will be seen. And they should be noted down when they are by the healthcare providers in the first instance. They are highly suggestive of abuse. When there are multiple injuries at different stage of healing, because it is a daily intake. Every weekly he is shattered, or he is tampered, he is beaten up, he is burned. That these child should be noted down. Burns, 10% of cases out of total case of abuse are due to burn injury. Burn is not due to a high flame or inflammable symptoms. It may be a minute things like the cigarette or some press, heated press, are they are just touch up and heated press are given. It may be shape. The shape and pattern of burn is very much diagnosed in this pattern on the forensic aspect. The geometric pattern we can identify, and we can suggest the object which was used for burning. Cigarette burn are very common, and even jokingly they are taken. These are the burn marks, some burn marks, and they are so typical. The impression marks of these burns are so typical that just by seeing the impression of this object which was used is very much evident. This casting iron, usually just for a tantrums, for a poor, for irritation, for even the parents get irritated for some small and small deeds, or for in the poor economic status, and they just take out the irritation by providing a burning the site at the site of arms, legs, and these effect and these burn injuries should be noted down when they come to the doctor, because they do not tell. They are themselves the blood relation who are abusing the child, and even the child will not disclose these injuries. But the pattern of injuries are very much typical, and if a healthcare provider is sensitive and sensible, these injuries he should note down, and he should take care of that. They might be due to child abuse, and such cases should be reported to the police with immediate action. Right? Head injury. Head injury are 95% serious intracranial injuries in infants are due to abuse, neglect. They are not taking care of the infants properly. And in 25.9% of cases, abuse is injury to head, face, or cranial content, which may result into severe coma, convulsion, apnea. Shaken baby syndrome is also a very commonly seen habit of intentionally or unintentionally, just for a joking sake, that the small infants they are shaken up severely. Sometimes cases have been reported that he was the child infant was severely crying in the night, and what to do, we did everything, now he is not conscious, and they see that what they will result is in the bleeding of the retina, coma, convulsions will be seen, and edema of the brain will be seen. And these are due to that they get irritated, they shake the baby, okay, okay, sleep, sleep, now sleep, and that results into small brain hemorrhages, which results into coma and convulsions. Next slide. Intra-abdominal injuries are the second commonest cause of death. Intra-abdominal injuries are most common because they are the hidden injuries. They may be timed that nothing is evident on external part, but there are severe injuries, lacerations in the liver and spleen. Sometimes even rupture of spleen can be seen with no evident or uh, no bigly evident external injuries. So they are most commonly kicks given in the abdomen for and the very common. If I say not sexual abuse, if we consider the physical abuse, the very much common thing is the toilet training. If the child are not accepting the toileting, usually the caretakers, the care providers, if they are left with the maid, they torture these children with the kicking and beating, and that is very much evident and should be noted down while doing the examination. Fractures are very highly specific of child abuse. Forceful pulling and pressing. Just pulling by the hand, shoulder dislocation is very much prominent. Pulling the arms so forcefully that the shoulder is dislocated. Unless and until the child is not facing the physical abuse, shoulder dislocation and these types of pull injuries are not common in any type of fractures or any hair fracture related things. So when there is a pull out injury, child abuse should be kept in mind. Hair pulling, patchy alopecia, the hairs are pulled out and they are not pulled out from the roots, they are broken. When we see and observe the alopecia, there are several lengths of the at different varying lengths the hairs are pulled out. We should have highly suspect that this is not due to alopecia or any disease or pathology, but it is a sign, symptom of child abuse and should be taken in mind. Next slide. This is a type of epiphyseal fracture which is most commonly seen in young childs and kids. Cot death and abandoning of infant. Cot death is usually between 1 to 6 months and maybe below 2 years. And it is not, these are the conditions affecting the infant. And these conditions should be kept in our mind while making the diagnosis of child abuse because they may be due to some pathological condition, unexpected deaths, which are suspected that they were babies which were caught between at their nostrils and mouth were just pressed down between the stripes of the cot, and these are unsuspected. It may be also due to infection, cortisol deficiency, hypersensitivity. So these pathological conditions needs to be ruled out before labeling it as physical abuse. Abandoning of infant is a punishable offense under 317 with 7 years fine or both, and children below 12 years are protected under the law. It is proved that the intention was wholly abandoning. It has to be proved that there was no other intention but of abandoning the child. Sexual abuse form a great part of the total abuse, that is 15%. And when we say sexual abuse, the first common thing which it starts from is a sexual play. Viewing or touching of genitalia, buttocks, chest of pre-adolescent children separated by not more than 4 years in which we have seen. It means it was seen that one child which was sexually abused was of 6 years and the above one was of 12 years. So that age difference was also not much. That one is definitely should not think that it can be only done by an adult to a kid, but a bigger child can done also sexually abuse a lower child or a smaller child. Sexual abuse is involving a child in any act. Previous slide, please. Any act that is intended for sexual gratification of an adult. It may be done by any family member, acquaintance, or by somebody which is least often by a stranger but known to the family. Any activity with a child before the age of legal consent, and that is for sexual gratification of an adult or a significantly older child, is also included as a sexual abuse. It may be oral genital, it may be genital, if the touch or the play can be played in a form of a genital rectal form, or hand genital, hand rectal, or a hand breast contact. So when we see the proportion of the sexual abuse, we do not see that we will say that 1 out of every 2 child is facing the type of abuse in some or other form. And it's high time that we should think over this and save the childhood and provide them a safe childhood. Now, when we see who are the abusers, they might be servants, caretakers, they might be sometimes teachers, drivers. Usually they are some or the other way, either maybe they be a known person, close known person, or a distant known person. But very rarely they are from totally stranger one. They are either known person visiting the home frequently, uncles, they may be cousins. It may be a stepfather is seen the rate is very high, 5 times higher than the natural father. And when we see these, the symptoms are you will see this bleeding from the private parts, vagina, penile, or rectal pain, bleeding. It may result into chronic dysuria, enuresis, constipation. They come for the complaint of dysuria and they do not give you the history of abuse. But when there is a history of chronic dysuria and you see the if on a rectal examination should be conducted, vaginal examination should be conducted, and there are features of suggestive of sexual abuse, then these cases should not just be treated as a disease but also be notified as a child abuse. Behaviors and behavioral change are usually seen in the specific to the abuse victim. It may be a seductive behavior, it may be a sexualized activity. Now, when they see some activity or some activity is done on them, usually when they play a role play with some other children, they will imitate that activity. So, while playing with other children, if they are playing with a doll, they will show that same activity, playing with that same activity. These small changes in the behavior of this child should be notified and noticed out, and they are very much implemented. They are at the high risk of suicide gestures as and when they grow up. They are very much psychologically disturbed. The mental health is very much disturbed in these victims, and many sleep disorders, withdrawn, stress, school performance suddenly fall down. They have a tendency of running away from from the home as soon as they see the perpetrators round about them, and they also get a tendency of self-mutilation, of self-humiliation. They feel they are the deprived person, they are the deprived kids. So these are the various behavioral changes that a victim undergoes while facing these abuse. And now with a short overview of the POCSO Act, this Protection of Children from Sexual Offences Act came into act in act from 2012, and it covers almost all the aspects of sexual abuse the childs are facing, and we will just go through them in an overview aspect. That it includes the sexual abuse of children, like the inducement or coercion of a child to engage in any unlawful sexual activity. It may be the exploitative use of children in prostitution or an unlawful sexual practices, exploitative use of children in pornographic performances and materials. Next slide. Say the provisions of Act, it includes any type punishment for sexual offences against children are for sexual assault, sexual harassment, and the pornography. And special courts trial have been established under this Act for conducting the court under the trial. The term we will define of each and everything, so how these POCSO Act defines the child. It takes of any person in gender irrespective, male, female, or intersex, and should be below 18 years of age. It also includes sexual assault, is defined as touch or make the child touch with sexual intent any part like vagina, penis, anus, or breast, or does any other act which involves physical contact, even if that is non-penetrative type, even if it is not any physical injury type, that even a touch is defined into the clause of sexual assault. Penetrative sexual assault includes penetration of penis or any object or part of body to any extent into the vagina, mouth, urethra, or anus of a child and makes the child do so with him. Even if the person is not doing it and making the child do so, that part of is also covered into the penetrative sexual assault. It also includes manipulation of any part of the body of the child to cause penetration. and it applies even to the mouth, his mouth to applying his mouth to the penis or vagina or anus or urethra of the child, or making the child do the same. Next, we will go into the aggregative sexual assault or aggregative penetrative sexual assault. Offense is called when it is done by a person on a responsible authority position, like a police officer, an armed force personnel, or a public servant, or a jail remand homes, and then educational or religious institute, etc., at the place of work or in jurisdictional area. Gang sexual assault, that is includes an assault which is done by one or more persons in which all the person are having a common intention. If even the sexual abuse or sexual assault is given by a one person and the other person were in that moment watching up or just observing that, but with the common intention of sexual assaulting the victim, they all are included into as a gang, and they all are included in the POCSO Act and covered as a gang sexual assault. Sexual harassment, which includes sexual intent with using words, sound, gesture, even showing any object of offensive object, or even showing any part of body to be seen or heard by a child. This also includes making the child exhibit any part or own body. It also includes showing any object in any form of media for pornographic purpose. Repeatedly or constantly follows, watches, concerts directly or through electronic, digital, or any other means. They are all included and covered in the POCSO Act as sexual harassment. To promote a child for pornographic purpose is also taken as sexual harassment. And we will say that sexual harassment from the down, not only sexual harassment, it starts with the harassment, sexual assault, penetrative or aggregative. All of child are cognizable, non-bailable offences under the section of India IPC code. When we see the punishment, you will see that sexual harassment has given a term of 3 years, which may extend and is under liable to fine also. Using children for pornographic purpose is not only first time it is of imprisonment of 5 years, but if it is repeated, the term increases to 7 years and is also liable to fine. Storage of the pornographic material results into an imprisonment of 3 years under the POCSO Act. Sexual assault covers a punishment of 5 years and may extend to not less than 3 years and extend to 5 years and is liable to fine. Aggressive sexual assault is from 5 years, may extend to 7 years, and there is also a huge fine in this. Penetrative sexual assault extends from 7 years and it may be extends up to the 10 years, and it may also extend to the life imprisonment and is liable to fine. Aggregative penetrative, when it is aggressive is involved, under the definition of aggressive penetrative, it is definitely not less than 10 years and may extend, depending on the responsible person, it may extend to life imprisonment and fine. So when we see all these things, we see that we have a POCSO Act which covers almost each and every act, each and every child